Hey everybody, Dr. Patel here. Sorry about the delay. Hope you all are doing well. Happy Friday. It's been a couple weeks since we talked, and we've gone over a lot of things in the past, both common and uncommon things, as well as various different ways of diagnosing and treating conditions. I wanted to go over a condition that's actually very, very common. In fact, it's actually a condition that affects literally everybody, but also doesn't really matter in most scenarios. And this is a condition that unfortunately ended up getting labeled with a particular word that made it something that's kind of exaggerated and kind of overemphasized, and something that we end up hanging our hat on as something that defines us. And quite frankly, it's sad that we've gotten to this situation with this particular scenario. Sounds crazy, kind of, because it is. But what I'm talking today about is degenerative disc disease. So degenerative disc disease sounds scary and sounds horrible because it's a disease, right? That word disease that was placed on this concept really has catastrophized the scenario and has made it sound, quite frankly, worse than it is. Because degenerative disc disease is not actually a disease. Degenerative disc disease is actually just disc degeneration, which is a normal thing as we get older. So I'm going to describe it, I'm going to explain it, and I'm going to explain what it is, why it matters, why it doesn't matter, and I hope you enjoy the video. If you have any questions, concerns, thoughts, comments, then please comment, or you can email us at info@fxregencenter.com. If you want to talk about your particular situation, you can email us or you can call us at 310-929-9790. And hello, Kathy. Thank you for joining. Hope you enjoy. So we're going to be talking about degenerative disc disease, or disc degeneration, which is the way that I like to call it. But what does that mean? So disc degeneration really just is in relationship to our intervertebral discs. So what are those intervertebral discs? The discs are the soft tissue cushions that are between our vertebral bodies. So if we think of our vertebral bodies, you may have heard me giving a talk before about how the vertebral bodies are like a stack of coffee mugs on top of each other. These are kind of funky coffee mugs, right? This is the mug here in the front, and the handles back here in the back, and in between these coffee mugs is a water balloon completely filled with jelly, and that is what's called the disc. And this disc is a shock absorber, right? It is a didn't mean that to happen. This disc is a shock absorber that essentially is a cushion between our vertebral bodies, and in actuality it's actually like multiple layers of rubber and then jelly on the inside. So those multiple layers of rubber are like the rubber of a balloon. I don't know what's going on here. I apologize. I'm trying to have a discussion here and my computer is giving me some difficulties. Let's see. I'm just going to go ahead and give up now. But this disc is like layers of rubber and then jelly on the inside, right? And it's like, people describe it as a water balloon, but a water balloon is so fickle, right? It's the balloon, the rubber of the balloon, it's actually thick, and it comes in these layers, and that's called the annulus, or annulus fibrosus. The jelly on the inside, that's called the nucleus pulposus, and that jelly is the the hydration essentially of that disc. So as we get older in general, our water balloons start to lose hydration. And when I say older, I mean over the ripe old age of 20 or 30. Right? There's studies that show that over the age of 30, greater than 30% of people have some sort of disc degeneration or disc bulge or something that's going on in the discs of their low back, even in the absence of pain. And arguably that number even increases in other areas like even the cervical spine. There's some studies that show that over the age of 40, greater than 60% of people have cervical disc degeneration. So what do these numbers mean? Well, these numbers essentially mean that this is a normal thing that occurs. Dehydration of the discs is a normal thing. And it's that dehydration which is what is called disc degeneration. And that's normal. That's okay. That's very, very common. And we see tons and tons of patients that, oh yeah, my pain just started 2 months ago, and I look at their MRI of their disc, of their low back, and they have substantial disc degeneration. And that disc degeneration didn't just happen 2 months ago. That had been going on for a long time. So what happens is that over time, this nucleus pulposus that has the jelly or the fluid inside starts to slowly degenerate. And what happens is that in an MRI you'll slowly start seeing some increased darkness inside the disc, and over time this starts to degenerate, and there's no longer any hydration that's over here, and eventually, ultimately, it all starts getting dark. So you may have heard the term dark disc. That dark disc phenomenon is because in an MRI, in the sequence that shows fluid as being white, this MRI that shows degenerative discs will, instead of showing a white disc, will show a dark disc, and that's where this kind of dark disc nomenclature has come from. So as that happens, basically the disc, if you imagine a balloon that was once completely filled with jelly, now has less water in it, you can imagine that balloon is going to start to get a little bit more jiggly. So over time, there's a little bit more motion that can take place. Now, that in itself, again, is not an issue, unless over time, because of that motion, we can start to develop things even like arthritis that can form in the various joints. Because as there's motion here, there's more friction that takes place, and the smooth surface called the cartilage starts to wear out. Now, even that arthritis does not necessarily equal pain, but you can imagine that this starts to go in a negative direction over time. But the disc, the disc is unique. It's not just like, I mentioned that it's like a water balloon filled with jelly and multiple layers of rubber, all that kind of stuff. But in actuality, it's more than just this balloon also. Interestingly, the interface of the disc with the vertebral body is called the end plate. And this end plate is actually technically a piece of the disc. It is actually continuous with the rest of the disc. And think of it as kind of like a sandwich bread on either side of the water balloon. Right? Now, as there's more motion, though, that takes place within that disc, there's going to be more friction that starts to take place on the sandwich breads there, and you start to get kind of like some cracks that start to form inside the sandwich bread. As we start to get cracks in that sandwich bread, that's what starts to lead down the route of what are called Modic changes, which are essentially changes that we see on MRI that are taking place within the end plates there. Now, certain Modic changes have been hypothesized and shown in some studies to be correlating with pain. So that might be an instance where degenerative disc disease starts to actually be symptomatic, is when we're starting to develop these Modic changes and where things are starting to get inflamed or irritated. Okay. Now, Another thing that can happen with this disc that is starting to degenerate is that imagine a water balloon that has less water in it. Instead of being nice and cushiony, it's getting a little bit more flimsy. So it's actually easier for us to put pressure onto the balloon. And if you put pressure onto a balloon, what happens? That balloon can actually bulge outwards. So disc bulges can occur as well. Technically a separate entity from disc degeneration, but can certainly be associated in the same disc. Now, as there's more dehydration and degeneration that takes place, and as there's more modic changes that start to go on over time, as there's more pressure throughout here, you can imagine that the disc height will actually decrease over time. As that disc height starts to decrease over time, that's certainly something that can change some of the biomechanics of what's going on. Because if this disc height decreases, then you can imagine that the space where the nerves are traveling over here can actually decrease. So what does that look like? If this guy starts to decrease, that didn't work like I wanted it to. Now, if this starts to decrease, let's see here. Right? It kind of worked. You got to get my gist here. If this height decreases over here, then the space right here where the nerves are actually decreases, and that can cause stenosis. Stenosis is narrowing of where the nerves are traveling, and as that space decreases, there could be more pressure that's placed on the nerves, and that can cause symptoms to go down the legs. So in this type of scenario, even though the disc degeneration is not necessarily the thing that's causing the discomfort, as the disc degeneration gets worse, it can contribute to worsening of something such as stenosis. Let's see here. Now, ultimately, disc degeneration is a normal thing, and that's the main purpose, the main thing that I wanted to kind of make sure that you understood from today's talk is that disc degeneration is normal. That's a process that occurs as we're getting older, period, and does not necessarily equal pain. What are ways that we can prevent disc degeneration from becoming painful? Well, keeping pressure off of these areas. If we keep our core muscles strong, if we're able to keep pressure off of the disc, even as that disc gets dehydrated, and even as there's pressure that's placed on the disc from just life and living in general, if we're able to keep everything moving the way that it should be moving, then pain does not necessarily have to occur. In fact, that's the way that we can try to slow down the progress of disc degeneration. Other things that can help with disc health are things like our hydration. Fluids actually make a big difference because, just as the disc is a dehydrated issue when it becomes degenerated, making sure that we have adequate fluid intake can certainly be helpful across the board. But it's not just fluid, it's how do we get that fluid that we're digesting, how do we get that to go into our disc? Well, actually walking can be fantastic. So walking, as you're walking and you have that kind of gentle hydraulic pressure that's placed on the discs, right? If you imagine the discs being our shock absorbers, when we're taking steps, we're actually causing a little bit of hydraulic pressure, and that hydraulic pressure actually helps suck fluid from the surrounding area into the disc. And that process, that concept is called imbibement. And that can help with disc hydration. So, one of the two best things that you can do is doing trunk stability and core strengthening exercises, and things like walking, and along with hydration. I guess that's three things, but three things that you could do. There's my post right there. 3 things to do to help prevent your disc from degenerating more: walking, core strengthening, and hydration. Now, if we do have back issues, it's important to take a step back and not just focus on the words that we see on our MRI reports that say things like disc degeneration or degenerative disc disease, right? But we got to recognize that there's a lot of different factors that are involved in the spine, and we shouldn't really just hang our hat on words and say, all right, I have this disease, so that's it. There's nothing that I can do about it. There's a lot that we can do, and it starts with recognizing that you don't actually have a disease. So I hope that all made sense. If you have any questions about disc degeneration, and if you're concerned that you have a disc degeneration condition that may actually be contributing to your symptoms, then please feel free to reach out. You can comment, you can email us at info@fxregencenter.com, or feel free to call us at 310-929-9790. If you have other topics that you want me to discuss, then please let us know. We're going to go on to talking about some different body regions month by month over the course of the rest of the year. So if there's a specific body region that you want me to discuss, then please let me know. Hope you all have a great rest of your Friday and a great weekend, and I will see you next week.